Hello and welcome to the Dr. Julia Sen Health and Wellness Podcast. I'm Dr. Julia Sen, and today I'm excited to be talking to a very talented lady who has her own medical tattoo clinic and training academy. So, Ophelia King, welcome to the clinic.
Hi.
Really excited that you're here today because what you do is so specialised and niche and something that most of us don't know very much about. So I'd like to start by asking you to describe the scope of your work as a medical tattooist.
Okay, so I, in the main, work with post-operative ladies and gentlemen within the breast cancer communities, working with scars for lots of different operations, tattooing for areola, trying to make the breast post-mastectomy look a little bit more like the breast should be and put them into the state that they were in before any surgeries happened.
So the areola is
It's the 3D tattoo nipple that I mainly specialise in. So when people have had mastectomy, there are so many different operations you can have. But if we're talking about a flat skin where they've lost their nipple and there's not been any possibility for having a nipple reconstruction, we can tattoo a 3D nipple onto the skin to make it look as if it's got all of the light bouncing in the right places. Not only, there's only a small section of these nipples that you will do because most surgeons these days can literally make a nipple from a skin graft. They do a small incision and will make a nipple bump, so that then that's where I come in and I will tattoo that and still put shadows in and mammary glands and make it look like a nipple, basically.
incredible. I've seen lots of fabulous examples of your work on your website. So at what stage after a reconstruction would you normally become involved?
So I might even be involved before reconstruction, to be honest, because a lot of ladies will, the first thing when they are diagnosed with cancer and will need chemotherapy, will automatically be thinking about eyebrows. So eyebrows are as important, if not more, than nipples, which I was quite surprised about when I first started tattooing because I thought it would just be nipples and only that. But obviously this is the first thing people see, and I think when you've been through such a massive transformation of those that have lost their hair, weight, all of that they really want their brows back on. And then during that time I can be establishing what kind of surgery they're going to be having, and we can be having a light discussion about what to expect. Having had a double mastectomy myself, I'm in a great position to be able to kind of guide them into what's worrying and what's not worrying, what to expect, what to take in your bag, and what to look out for. So when they come back to me for their brow top up, often we can then talk about they've had their operation, of which there's many. There's probably everything is so bespoke due to the kind of cancer you might have or the kind of skin that you might have. So we can then talk about disguising scars and creating a 3D nipple if so required on flat skin, or if the surgeon has created a nipple, which is they can actually do, I can be also pigmenting that so it looks realistic. I mean, some of them are really, really, really realistic, which is great because obviously when you've gone through all of that trauma, you want to feel in the changing room, you want to feel normal.
Absolutely. And I've seen some incredible work on your website. And honestly, I think if I didn't know that that was work that you'd done, I would have assumed that this was what nature had given that person. So incredible, the work that you do. I agree with you. The brows are so important, aren't they? It kind of intersects with some of the work that I do because they form so much of our nonverbal communication when we're out in the world. So, and it's really good that you have that opportunity to not only help women with that, but also give a holistic approach to where their journey is going and lots of aspects that they might not have necessarily thought about for themselves. So your personal journey with breast cancer goes actually back a very long way, doesn't it?
It does. So my family as I've got older, and gone through the family tree, it goes through 3 generations basically. And my mum had breast cancer when I was 24, basically. That's quite young. And having lost my dad when I was 18, I did nothing but worry about my mum. And she decided to have a single mastectomy with no reconstruction because she didn't want to go through any more surgeries again, and had radiotherapy, and then was able to manage it with diet and exercise. And she didn't live till she was 75. So she did really, really, really well. When I had my daughter at 40, I just remembered all of the trauma that I went through worrying about my mum. Not that I ever disclosed this to my mum. And I just thought, I just really don't want her to have to go through that. Now, at the time, I had had several nodules, biopsies, and I had a massive thick file with the breast tissue. And I was going once a year, twice a year in some cases for checkups. And it really got into my mind. I was high risk, and a very lovely surgeon gave me a window of opportunity, which I was able to have a double mastectomy with immediate reconstruction. At the same time, Angelina Jolie had hers actually. And at the time, I remember thinking there was so little on the internet. There was only one YouTube video of one lady in America who had videoed her whole journey. So after I had had mine, I thought, when I did make the decision to become a medical tattooist, I wanted to grab this earlier on, because I was looking for, what do you look like afterwards? Where are the scars? Is it going to look an awful, or is it not? Well, the work I see that comes through my clinic is high standard, so much as so it's better work than normal breast uplift or breast surgery I'm seeing. So I thought, I want to be able to talk to these ladies earlier on in the journey so that they don't have the worry of looking disfigured. I say, I don't really even want to use that word, but I don't want them to have the worry of looking awful. I want to be able to help them, and empower them to get back on the road as quickly as they can.
Yes. Well, just you being able to say to them, your breast is likely to look better than if you just had an uplift.
Yeah.
I mean, nobody, I think, starting on that journey would imagine that that's a possibility. I think all of the mental images that we have are of disfigurement.
Yes.
And so it's such a great gift that you're able to give to your patients, to give them that hope, and that very real hope that they will end up in a really good place, and they will end up being feeling very positive about their bodies.
I mean, in some cases, I even put them in contact with, if I think, I know this lady's customers had the same operation, and then they're a similar type of like-minded person. I often connect them together so that they can talk and share pictures. And the whole breast cancer community is a very, very tight-knit, amazing community where everybody helps each other. It's a wonderful place for therapy. When you're going through the process, and there's another thing I try and drop in to when I'm tattooing them initially is, I will say to them, have you thought about joining any of these groups? And a lot of them will say, oh, no, I can't do that, because they're, some of them will say, yes, I will, or some of them will flat say, no, I really don't want to, because they're assuming these groups are all morbid and they're going to rock up and talk about death and dying and funerals. It's nothing like that. And the charity that I work with, which is Ladies Fighting Breast Cancer, is just the most amazing place that you can be. They're based in the West Midlands, and they are a really small charity when they don't rely on large donations. It's all about a lot of the ladies who have had the breast cancer are knitting hats or drain, when you come out, when you've got your drains, knitting drain bags. They're making tapes, they're raising money here with bike rides and marathons, and they sing and they have a laugh and they make friends, and it's just a really nice place to be. So I try to guide them into that kind of pocket of people, because it's going to really help them, because it's a whole different journey when they're in it.
Yes, of course.
They need support.
Yes, absolutely. And I think being with people who are so positive, ultimately when you come out of the other side. So our first podcast was with Jean Farley, who's a breast cancer survivor. And she said to me on the podcast, I think I've had more out of cancer than it's had out of me.
Yes.
And she identifies the way that having been through cancer has changed her for the better, she feels. But I think a lot of that comes from the people, the incredible people that you meet in that journey that you maybe wouldn't have met otherwise.
Yes.
And I've met some of the ladies fighting breast cancer ladies, and they really are wonderful, aren't they? They are our clinic charity.
Yes, they do some amazing work, and I'm always very proud to be part of what they do and try and help and raise money where I can, basically. But I do think support's a massive thing to do with it. So once we've kind of done that, so they'll come back to me after they've had their surgery, and we will I will show them examples of what I have done before that, where what their end goal, so that they've got something to look forward to. And we'll choose our inks and our pigments, which are medical grade pigments. So a lot of the fear with tattooing comes from a lot of ladies who've been through chemo. They don't want to put anything that's toxic within the body. So the range that I use is specifically for this medical tattooing only. We will choose some lovely pigments for them, and it will take what this is often surprising. Sometimes you can have a lady come in and I'll think, wow, this is going to take me 3 hours, and in an hour it can be complete, because you don't really know until you get into the tattooing with the skin, whether the lady's skin is going to tolerate the ink or not tolerate the ink. You don't really know until you get into the tattooing itself, is how long it's going to take. Often it's a really, really beautiful thing to do, because we're like, ta-da, it's done. And they're like, wow, this is amazing. I didn't realise that we could have it finished. And this is just, so it is a really wonderful thing.
But they want to go out and show everyone, don't they?
They do. They do.
So you mentioned about skin tolerating or not tolerating. Are there any specific risks that people need to be aware of that you talk to them about?
I think only through my own journey and through one of my very first cases, I had double mastectomy, and I had 2 different types of implants. I went direct to implants. I had smaller boobs and thought, well, actually, if I'm going to go all the way through this, I may as well go a cup size higher. So I had a silicone on one, and I had saline on the other, and I had what's called expander implants, which are an implant that go in with a tiny little porthole that go in the side there. And then once you've healed and the skin's healed, your surgeon will put in a saline so that you can go stretch the skin over a course of 3 to 6 months to wherever you need to be. Now, on one of my side, I had a little bit of necrosis because there wasn't enough airflow.
So tissue breakdown.
And at the time, it was traumatic, but it was all fixed really quickly. I had to have my expander taken out, and then I had to go through the whole process again on one side. And I really didn't mind at all. It didn't look like you think it was going to look. It looked like a tiny breast. I was able to sleep on it, which was fab. And it took me 3 months to heal, and then it went back in. But the skin on that side is so thin. It's paper thin. And one of my very first clients, she was a model, had the same situation that I did. And on her breast, we just had to stop halfway through, because I could see that we were getting really close and the skin was so thin. But you learn. But then often the procedures that go really well are the diet flap operations, where they will take your tummy and they will give you a tummy tuck, and they'll make a breast out of your own tissue, because you've got loads of bounce and it's really nice tissue. Often the tattooing on that is a lot better because there's more to work with
than
an implant itself. But having said that, I've got some phenomenal examples of some amazing boobs with the most amazing tattooing that you'd forget about it, completely forget about it. I mean, I've forgotten about mine, even though I have got a little bit more scarring, but I mean, there's not a day that I kind of think about, have I got breast cancer? And my surgeon will often say, well, you've got no breast tissue, so you can't have any, but we will check you. So
it's been really positive.
very positive, yeah.
I'd like to take a little bit of a step back into something that you talked a little bit about, and that was your mum's journey, and also yours, I'm sure, and all of the things that you did proactively in terms of your lifestyle.
Yes.
Your mum chose not to go down too medical a route, which we obviously wouldn't condone.
No.
However, what were the things that she did that you then took away during your journey?
And the things I took away are the things I always advise my customers. So we're from a very bohemian background, my family, and she was like, I'm not having that in my body. Not that we condone that, because I've got other examples of working side by side with nutrition and chemo, which is the better option. Carrot juice. There's quite a big study on carrot and beetroot juice, where beetroot specifically oxygenates the cells. So no sugar, which obviously we know it's a breeding ground often for things. So she was low sugar. I wouldn't say no sugar at all, but low sugar juicing is the most fantastic thing to do. She was very, very fit until she had an issue with her back, which I think actually was what was the final nail in the coffin with my mum, is the lack of movement. So she was an avid gardener and was always hauling big plant pots around the garden and outdoors. And she had a problem with her back, and that kind of slowed her down a bit in your 70s. I'm sure you do slow down as well. And that kind of is where I just saw a big decline. And it's something that I've also looked into, is sort of like keeping moving, bone density, making sure that you're doing resistance training, and diet, I think, is key to, obviously you have to define line between enjoying yourself and diet, but I think diet plays such a massive part of our cell development and how healthy we are.
Yeah.
And, helping fight off cancer cells.
It's interesting what you say about beetroot juice specifically, because apparently it's been compared to Viagra.
Is it?
Because of the oxygenation, the improvements in circulation. It's certainly something that
really
I've come across.
interesting.
It is, isn't it?
We drink it.
No wonder you both look so happy.
I do drink it. I drink it every day, and I have it as my first drink of the day, before I've had anything in my tummy, and then I have it as my last drink of the day as well. So,
well, you're looking fabulous on it. So I think that I'm gonna need to start drinking the beetroot juice.
I do say to the ladies, and I got one client who came in, and she had stomach cancer, and she'd got lesions on her liver as well. And she had this probably 20 years ago, and she said that she marched into the QE with her juicer, and the nurses were looking at her as if to say, what are you doing? And she was making all this green juice and kale and spinach and everything, and alongside her chemo, and she's looking fantastic. In fact, she was such an inspiration for me trying to roll this out with a lot of my other clients. When they're coming to see me, I always try and gently break it into, as I'm tattooing them. So, do you having any sugar? Are you doing anything? And I try and gently, people will either take the advice, or you can get around it in a very subtle way.
Yeah.
But I just think diet plays a massive part of staying healthy.
I agree, and I think the other really great thing about diet and other lifestyle choices is that you can feel very hospitalized and institutionalized, and you're having all of these things done to you. But that's something that I think you're investing in yourself, something that you are doing for you, that's really helping your body to fight the disease. And if you've had destructive treatments like chemotherapy, radiotherapy, to allow your body the tools that it needs to rebuild itself. And I think that now there's beginning to be a recognition, and people are being told about this a little bit more, but I really think that it should be something that is really promoted, because it's what we do the other 99% of the time that's important, and also in terms of prevention.
Yes.
And in the long term, you've kept up these really good habits which will protect you from other diseases,
Yes.
that you might have otherwise succumbed to. So I'm really delighted, because it's something that I feel very passionate about, and I love that you talk to your patients about all of that stuff, because they get so much more value from meeting you and being treated by you. So you are now a teacher as well. You have your own academy, which is really exciting.
Yes.
So tell us about that, and how one enters your academy.
So when my mum passed away, as you do, you go looking to talk to them. So I'd contacted a clairvoyant, and a clairvoyant said to me, "You're going to be doing something different with your hands." I said, "Oh, I've actually just started tattooing." She said, "Oh, you've got healing hands. I can see purple light." And you take some of this. I said, "You're going to be teaching. You're going to have lots of people around. You're going to be teaching." I just thought at the time, that's a bit, that's a bit too much to take on board just yet. But actually, it's always been at the back of my mind. And as I've got into this permanent makeup business, which permanent makeup you can do so much with, you can really, really, really make a massive difference in somebody's appearance. We're doing such tweaks, classic tweaks like eyeliner or brows or a lip blush. But I thought there needs to be more of me's in the community here, that we can use these breast cancer communities to get them more free work. So I thought, right, okay, let's get training. So I did the teacher training course and set the business up, and I got my husband involved, he had just finished a cancer journey, which he was also on the beetroot juice as well. So I thought, this is great, because we can now try and get more people in the community that can do this. So I've set up a great tattooing business, which is geared towards anyone really of an age with a creative aspect, that's, wants to take his passion commitments. So somebody could come to me with no experience whatsoever, and the pathway would be, I would spend time with them, seeing if they can hold a tattoo machine, seeing how they shade, working out, if they're going to be, able to actually do this. Or you can come from somebody like yourself, from a medical background. I have a lot of nurses, the last two have been nurses that I've trained, that want to add it into their business portfolio. If they're already doing aesthetics, it's a great thing to add in, because I think when you have an aesthetic company, and somebody of an age comes to you with nothing, they automatically think, well, I've heard Botox everywhere, it's got to be the Botox I go for. And actually, sometimes they just need some brows.
Yeah.
They just need some brows and a little bit of skin boosters, as opposed to that. So, but I thought, right, we can use the modelling, we can use the breast cancer community for the models. So they're going to be getting treatments more so than they normally would. So they're getting lip tattoos, they're getting eyeliner, they're getting brows, they're feeling great. And, I just wanted to get more people out there doing this to help people, feel more than, of themselves, basically, after trauma. But there are sort of an element of men as well that I treat for things like vitiligo, which we do cover on the course. That's also another issue that is more common in men, I think.
Do micropigmentation in hair as well, don't you? Yeah.
And that's another great thing to offer for men as well. So we mustn't forget about those men, because they also, they need a little pick me up as well.
Yeah.
So it's basically, the training is aimed towards medics or non-medics. I'm prepared to guide them through a long journey or a short journey, depending of which they want. But I think it's always a great thing to add into the clinic.
Absolutely. And I mean, as you know, a lot of the work that I do is skin cancer and reconstructive surgery in the eyelid area. And so there are times when I'm taking away sections of people's brows, parts of people's eyelids, and reconstructively, obviously, I try to make sure that I do as good a job as I possibly can. So when I found out that you had an academy and saw the quality of the work that you do, I felt so inspired. So so we're going to be training together. You're going to be training me, aren't you?
I can't wait.
I can't
wait.
because I think it's beautiful, and really I see how much small changes in people's face make such a massive difference in their confidence, both negatively and positively, depending on which, what's happening to them. And so I'm really looking forward to having this as something else that I can offer to my patients. And
it's nice to hear a surgeon actually say that, because what astounds me sometimes is that young ladies are going for very expensive breast operations, and what I'm seeing when they come back is it's a great shape, but there's massive scarring, and often sometimes when you move a nipple it can grow and spread beneath the breast, and there's no advice from the surgeons or hospitals to say we can fix this, there is a way around this, we can, and they're not talking to the clients about medical tattooing. So I think it's great that you're thinking about doing that, because you can do the surgery and correct any scarring afterwards. Not that you'd need any corrections, I don't think.
It's a lovely thing to be able to offer. So I'm really excited, and I'd just like to say thank you so much for coming along today. It's been so interesting talking to you, and I knew very little about this world that you occupy, and only a small amount about what it was possible to do. So I've learnt masses, and I'm looking forward to our onward journey together, Ophelia.
Well, thank you for having me.
Oh, you're welcome. Thank you for listening to our podcast today. If you enjoyed it, then please subscribe for future podcasts, and you can also look at previous podcasts that we've recorded on Dr. Julia Sen Health and Wellness podcast. Ophelia King can be found easily online by putting into Google Ophelia King Medical Tattoo, or you can find her on the askwisewomen.com website. Until next time, thank you.